Hi, everybody. Welcome back to our show. Today, we're going to be talking about vaginal rejuvenation, why people love it, why you need it, and what it is.
Awesome. Let's dive right in.
So, Dr. Kesty, what does vaginal rejuvenation actually mean?
To me, what vaginal rejuvenation means is we are using lasers and other technology to restore the skin and some of the muscles in the vaginal canal and the labia minora majora. So I tell patients that all the skin on your body ages, right? We care a lot about our face, neck, chest, hands, but the skin on your labia minora majora and in your vaginal canal, vaginal introitus, all of that ages as well. So we get symptoms as we age and as our hormones change, especially around kind of menopause, perimenopause. So what that looks like is, it can be more sensitive. It can kind of loosen and be a little bit more prone to kind of the shearing forces when you have intercourse. You can have less sensation during intercourse. You can also have problems after if you've had a baby vaginally or if you've carried a child or even if you haven't had a child, you can have some problems with incontinence as you age. All of that is just, there is some muscle involvement, but a lot of it is just the normal natural skin aging everywhere on your body. So to me, what vaginal rejuvenation is we are kind of restoring the youth and restoring some of the collagen in that skin. And, we're talking about different types of skin, right? The skin on the vaginal introitus, vaginal canal, obviously that doesn't have a stratified squamous layer, but the skin on labia minora majora does. So we're treating them differently kind of as we're talking about kind of holistically restoring that skin. So
Yeah, I mean, I have patients come in, perimenopause, menopause after for vaginal, childbirth or just kind of aging, less sensation. Itching is a big one too. Changes in even like external anatomy, like labia minora getting larger or any of those kind of symptoms or visual kind of changes that people are noticing. Pain during intercourse, lichen sclerosis, even other kind of medical conditions too that patients have. And we're then recommending vaginal rejuvenation.
and or treatment. I mean, if someone has lichen sclerosis, we'll get them on some sort of treatment, oral or topical, and do the vaginal rejuvenation at the same time.
Exactly.
So yeah, I kind of think of vaginal rejuvenation as you have, what I like to call a cosmetic component, so how it looks, and then you have kind of the sensation component, so how it feels. So, you can kind of piecemeal a laser plan together for patients based on kind of what they want. If someone's just having incontinence, then you'll probably just do some fractionally ablative kind of mostly in the vaginal canal, some on the outside as well. If someone wants, a restoration of some of the tightening on labia minora majora, you can talk about doing the skin tight and some kind of laser tightening on top of that. If someone wants, better, stronger, easier orgasms, then you can do some PRP injections and some laser as well. So there's a lot of different specific like treatments. I think it's just during that consult, spending time with the patient. What are your goals? What symptoms are you having, if any? Taking into account patient's age. You're going to treat a 30-year-old who just wants better orgasms different than, a 65-year-old multi-parous woman. So it's nice that we have so many options. It's just kind of our job to kind of guide the treatment and kind of put together a collection of treatments for that patient.
Yeah. So what lasers are you using?
For the vaginal canal and then the, labia minora majora. So we can call that just like the outside part. Those are going to be your CO2 and your erbium would be kind of the most popular ones. If a patient does have lichen sclerosis, I will tend to do more erbium than CO2. I think it does a little bit better for the lichen sclerosis. I think they get better symptom resolve. And then for the vaginal canal, if someone has some incontinence, I prefer CO2 because I do think you get a little bit more tightening. You get a little better relief of their incontinence symptoms. So, and then just overall with lasers. And then I like the tightening lasers for outside, skin tight, RF, all of those things are really, really nice for kind of tightening labia minora majora if that's something that they are interested in. That's always an option.
So we usually do an internal one
Mhm.
where we're actually using the laser internally on the vaginal mucosa. And then externally, we are using a laser as well. And then Dr. Nessie was talking about like RF microneedling and things like that that we can do on the external part of that too. That's kind of the major lasers that we're using.
Yeah, and I think, partnering with, urogynecologists, plastic surgeons, if they want something that we can't deliver, if they want a fat transfer, something like that, we're lucky to have good colleagues here locally that we can kind of refer to and share patients and kind of get the patient that result if we need something more drastic, if they need plastic surgery or something like that. I think, when we're talking about vaginal rejuvenation, as a physician, you really have to kind of know what is in your lane and what isn't. And, I'm not going to do a fat transfer here in the office. I'll put a little bit of filler. If someone needs a little bit of, dermal filler, I'll obviously do laser and PRP. But, if someone needs a sling or something, obviously you have to know the right people to, partner with on this.
Speaking of PRP, where and why do we use PRP?
So I really like PRP. I think that, I love PRP as an option, even for my younger women who just want a better sex life. It can definitely help with easier, stronger, better orgasm. So what I'm doing is I'm drawing a small tube of your blood, spinning it down their centrifuge, with our activator, and then I'll inject it into the clitoral hood, and then also kind of anywhere between 1 centimeter, 1 inch into the anterior vaginal wall. I think both of those places, if you can get a decent amount into both of those places, do that, once a month for 3 months is my protocol, and then every 6 to 12 months afterwards. Women love that kind of even by itself as a standalone treatment. I think women get really good results from that. So
yeah, definitely like increased sensation, a lot more kind of like even like lubrication from vaginal rejuvenation and things like that too. That's really important. That we definitely see as well. I would say my patients are the happiest after they get any of these procedures done.
everyone's happy.
Everyone's happy after this, series. We usually do 3 sessions about a month apart or 2 months apart, and it kind of changes people's lives. See, I have women come in their 60s and 70s who, have painful sex, who don't want to be intimate with anybody, and now we're just saying like, well, this is my last hurrah as far as this, and this is something that is a game changer for a lot of women. They can have comfortable, pleasurable sex in their 60s and 70s. And that's extremely important because it changes their whole outcome in life.
Yeah, for sure. I completely agree with you. I mean, the change of, the everything after something like this. And I think even if you're not someone that if you're in your 60s and 70s and you're like, well, I don't want to be sexually active, that's not part of my life, that's not my goal. I do have patients that, we don't necessarily like we're not doing this so that they can have like better sex. We're just doing this so that they're more comfortable in their clothing, because I think as women age, that vaginal tissue, if it gets too dry, like they have trouble like wearing workout clothes, going and doing a workout, going for a long walk, like with their dog, because that tissue can just be so friable, and even the friction of kind of everyday life. So I do have patients that, are not necessarily doing that with that in mind because they're maybe not sexually active, don't have a partner, whatever it is. And they're a lot more comfortable kind of in their own skin, even just doing it for, their own comfort every day. So
yeah. And I think it all depends on like kind of their goals but thankfully we've had really good success with all things as far as, okay, for orgasms, for better sex life, for, symptoms in that area, anything as far as like the looks of it externally that we can do to help as well. So we have kind of like a whole round team as far as, what we got going on here.
but yeah, I definitely agree. Happy patients. If someone's coming in for a vaginal rejuvenation treatment, what does it feel like? Is there pain? Is there downtime? Tell us about it.
It's, we do topical numbing. We'll, have you put it where we think we'll instruct you where to put it, but you'll put it internally and externally. You numb for about an hour. It's relatively comfortable. I would say minor pinching. You really don't have too much sensation or pain receptors in the vaginal canal. So really that'll just kind of feel like almost like a little cramping. And then, externally, most of the numbing cream will kind of take care of that mild pinching. And then, afterwards, we ask that you don't have sexual intercourse for 48 hours afterwards. And then just kind of mild swelling, mild redness in that area. But that also should subside within 48 hours because the mucosa down there heals very, very quickly and very well, usually.
I tell patients they can go back to work or, whatever they want to do afterwards. I wouldn't necessarily go do like a hot yoga session 30 minutes after vaginal rejuvenation, but they go back to work, they go, I do whatever.
Yeah.
Thank you so much for listening to our conversation about vaginal rejuvenation. There's a lot of lasers and PRP and options out there for you, I would definitely get with a cosmetic dermatologist that has all these options and that does partner with other people that take care of this area as well. Thank you so much for listening. If you have any questions, please let us know. Yay.